This presentation is about type 1 diabetes.
Type 1 diabetes is a chronic autoimmune disease that prevents your pancreas from making insulin, a hormone which regulates sugar in your blood. The body attacks cells in the pancreas that produce insulin, leading to hyperglycemia and later symptoms of T1D.
T1D is internationally common. In the United States, there are approximately 1.24 million people that are diagnosed with type 1 diabetes, with that number estimated to grow up to 5 million by 2050. Most people in the U.S. affected are children, however, adults have been diagnosed as well. Worldwide, in 2021, there were 8.4 million people with T1D, with that number expected to grow to 13.5 to 17.4 million by 2040. Symptoms of type 1 diabetes include excessive thirst, frequent urination, extreme drowsiness, unexplained weight loss, and also increased hunger, bedwetting in children, mood changes, weakness, abdominal pain, and blurred vision can also indicate type 1 diabetes. The 4 T's of type 1 diabetes include toilet, thirsty, tired, and thinner. This is an acronym used to educate parents about common symptoms of type 1 diabetes. 9 out of 10 parents do not know the main symptoms of type 1 diabetes. An onset of symptoms can occur at any time, but symptoms usually start appearing in childhood or young adulthood. A glycated hemoglobin test is used to diagnose type 1 and 2 diabetes. A blood sample is taken from a patient's vein and sent to a lab for analysis. It's often more accurate than random and fasting blood sugar tests. It measures the amount of blood sugar attached to the protein hemoglobin in the RBCs and shows your average blood sugar level for the past 2 to 3 months. The higher the blood sugar level, the more hemoglobin with sugar attached. A1C of 6.5% or higher on 2 tests can indicate diabetes. People of all ages can develop type 1 diabetes, but it is often diagnosed in childhood, while type 2 diabetes is diagnosed more often in those over 45. Type 1 diabetes is often mistaken for type 2 due to their similar symptoms. According to Eason, 1 in 3 adults developing type 1 diabetes are initially diagnosed as having type 2 diabetes. Diabetes autoantibody panels can be used to distinguish which kind of diabetes an individual has. Autoantibodies are antibodies produced by the immune system that mistakenly attack an individual's own proteins or tissues. The antibodies tested for are islet cell autoantibodies, GADA, glutamic acid decarboxylase autoantibodies, insulinoma associated to autoantibodies, and insulin autoantibodies. People with type 2 diabetes don't have these antibodies. Recent guidance by the American Diabetes Association and European Association for the Study of Diabetes recommended islet autoantibody testing at diagnosis in all adults with clinically suspected type 1 diabetes. Here we have the causative factors of type 1 diabetes. According to the article titled Type 1 Diabetes Mellitus, published by Harvard Health Publishing, type 1 diabetes is an autoimmune disease, which means the body's immune system attacks the body instead of outside invaders. In this case, the immune system destroys insulin-producing cells, beta cells, in the pancreas. Over time, the amount of insulin made by the beta cells decreases to the point where blood sugar becomes dangerously high. What causes the immune system to attack the beta cells remains a mystery. Current thought is that a genetic factor makes a person predisposed to the disease, and an environmental factor triggers the start of the disease. Viral infections and diet are 2 possible triggers. The Coxsackie, rubella, and mumps viruses are all possible triggers because the disease sometimes starts after one of these infections. Cow's milk is one dietary factor that may be related to the development of type 1 diabetes. Babies who are breastfed have a lower risk of type 1 diabetes than babies who are not breastfed. Type 1 diabetes is not caused by the amount of sugar in a person's diet before the disease develops. What occurs in the pancreas of somebody who has type 1 diabetes? The pancreas produces insulin, a hormone that helps regulate blood glucose levels. The cells that produce insulin are called beta cells and sit in the islets of Langerhans, a set of structures within the pancreas. T1D occurs when the pancreas does not make enough, if any, insulin. Your body still breaks down the carbohydrates from food and turns it into glucose, but when the glucose enters your bloodstream, there is no insulin to allow it into your body's cells. More and more glucose then builds up in your bloodstream, according to Diabetes UK. Without this hormone, the cells cannot get enough energy from food. This results from the body's immune system attacking the insulin-producing beta cells in the pancreas. The beta cells become damaged, and over time, the pancreas stops producing enough insulin to meet the body's needs. What causes the symptoms of T1D? Before diagnosis, your body tries to get rid of the glucose through your kidneys, and that makes you pee a lot. Peeing so much leads to another symptom, extreme thirst. Because glucose can't enter your cells to give you energy, you feel incredibly tired. To try and get energy, the body breaks down fat stores to provide fuel. That's why people often lose weight before discovering they've got type 1 diabetes. According to the article titled Diabetes Mellitus from the Gale Encyclopedia of Public Health, uncontrolled diabetes is a leading cause of blindness, end-stage renal disease, and limb amputations. It also doubles the risks of heart disease and increases the risk of stroke. Eye problems including cataracts, glaucoma, and diabetic retinopathy also are more common in diabetics. Diabetic peripheral neuropathy is a condition in which nerve endings, particularly in the legs and feet, become less sensitive. Diabetic foot ulcers are a particular problem because the patient does not feel the pain of a blister, callus, or other minor injury. The most serious consequence of this condition is the need for amputation of toes, feet, or legs due to severe infection. Heart disease and kidney disease are common complications of diabetes. Long-term complications may include the need for kidney dialysis or a kidney transplant due to kidney failure. Babies born to diabetic mothers have an increased risk of birth defects and distress at birth. Unlike type 2 diabetes, there is no known cure or reversal for type 1 diabetes. It can't be prevented, but there are several treatment options to manage one's blood sugar levels. Most oral diabetes medications are not recommended for type 1 diabetics, but they do take insulin. Insulin is a hormone created by the pancreas that controls the amount of glucose in a person's bloodstream. In type 1 diabetes, a person's pancreas makes little to no insulin of its own. Synthetic human insulin that acts like the insulin found naturally in the body is injected via a syringe, pump, pen, or inhaled via a pre-measured inhaler. 5 types of insulin include short-acting, long-acting, rapid-acting, intermediate-acting, and a combination. The 2 most popular treatments for monitoring blood sugar levels are a blood sugar meter, also known as a glucometer, which is used to measure the small amount of blood produced by a finger stick. A new sample of blood is needed each time. The results are available instantly, and they are utilized several times a day to ensure the individual's levels are within the guidelines of their treatment plan. And a continuous glucose monitor. A CGM uses a sensor placed under the skin to measure a diabetic's blood sugar levels every couple of minutes. Results are usually viewed on a mobile device, and daily testing with a glucometer is still necessary to ensure that the CGM is reading accurately and doesn't need to be recalibrated. Additional treatments include diet and lifestyle modifications. Counting carbohydrates is a method of counting the amount of carbs consumed in each meal to ensure the proper amount of insulin is taken as coverage. Some diabetics will consume the same amount of carbs for every meal to make calculating the proper dose of insulin easier and more routine. Exercise tends to increase a type 1 diabetic's insulin sensitivity, meaning that after they exercise, their body doesn't need as much insulin to process any carbohydrates they consume. Vigorous exercise can cause hypoglycemia, so type 1 diabetics should closely monitor their blood sugar level before and after exercise to properly adjust their insulin or nutritional intake. A balanced diet consists of whole grains, proteins, non-starchy vegetables, foods with fiber, fruit in moderation, and plenty of water. A pancreas transplant is also treatment for a type 1 diabetic. A healthy pancreas is taken from someone recently deceased and replaces the type 1 diabetic's pancreas so that their body can produce its own insulin. Pancreas transplants are not typically considered a cure because many patients may still need to inject insulin and take medications to prevent the rejection of the new pancreas. These immunosuppression medications have their own side effects that make type 1 diabetics wary of pursuing this treatment unless all other treatment options are exhausted. This treatment requires lifelong immunosuppression drugs that could lead to severe infections or nephrotoxicity. In conclusion, type 1 diabetes is a complex and highly individualized autoimmune disease. Further research and experimentation is required to find a possible cure and to develop safe treatment options that don't involve the lifelong use of insulin.